In order for air to be exchanged between the outer environment and our thoracic cavities, there has to be a pressure gradient. In other words, there has to be a pressure difference between the inside and the outside of the body. In order for inspiration to take place, the air pressure or the gas pressure within the lungs must be lower than the outside pressure. That helps to move air or gas from the outside to the inside. The converse is also true. In order for air to leave or be expelled or exhaled from the body, the pressure inside of the thoracic cavity must be greater than the pressure outside. So with the higher pressure being inside, that helps to force air to the outside of the body. So a pressure gradient must be established in order for either of those two situations to take place. So let's take a look at how this works. Firstly, we have to come to an understanding regarding a couple of important pressures that help to drive air in and drive air out of the lungs. The first pressure is atmospheric pressure. The atmospheric pressure, the pressure of the air outside of our bodies, is approximately 760 millimeters of mercury. You should recognize that unit of pressure because we use that unit of pressure when we studied blood pressure, except in that case, we were studying liquid pressure, but still the unit is the same for both. And 760 millimeters of mercury is the air pressure at sea level. Another important pressure has to do with the intrapulmonic pressure. And this is the pressure that exists within the trachea, within the bronchial tree, and within the alveoli themselves. And this pressure can fluctuate over the course of a respiratory cycle. So it doesn't have just one number, but a range of numbers there. And we'll talk about that here in just a moment. The next important pressure has to do with the intrapleural pressure. So this is the pressure that exists between the visceral and parietal layers, those membranes that surround the lungs. If you recall from earlier studies, those two layers have a small amount of watery fluid that exists between those two layers, which helps minimize friction of the lungs against the chest wall and other nearby structures. So the inherent pressure between those two layers is about 58 millimeters of mercury. So knowing these sort of pressures, we can better understand how air moves into and out of the lungs. So there's a special relationship between pressure and volume. And when we talk about the pressure of a gas or air within its container, that pressure is inversely related to its volume. And this inverse relationship is described by Boyle's law. And Boyle's law simply states that when the volume of a container of gas is larger, the pressure in that container is reduced. Also, if the volume of a container of gas is small, the pressure within that container then increases or goes up. But regardless of that relationship, the movement of air is related to a pressure gradient. So we're going to understand that relationship between pressure and volume in order to understand how air moves into and out of the lungs. So let's consider this upper diagram here for just a moment. Here we have a syringe which has a volume of air or gas within it. So this syringe is basically representing the lungs. This first syringe has a quantity of gas molecules, whatever that is, or a volume of gas molecules. Now, if we take this syringe and draw back the plunger, that allows for more volume within the syringe cavity. However, what that is doing to the pressure of the gas within that volume is to reduce the overall pressure. Because the gas molecules have more room to move around, their pressure against their container walls is less compared to our starting volume, which is the syringe that's on the far left. So when the volume goes up, the pressure of the gas molecules bumping into each other or bumping against the wall goes down. Okay. So on the far right of this diagram, we have our gas-filled syringe, but this time we're going to push the plunger in to the syringe. That ultimately reduces the volume within the cavity of the syringe. And so the gas molecules are forced closer together, and because of that smaller area, the gas molecules are bumping into each other, bumping against the walls at a greater rate. And so overall, that causes an increase in the overall pressure of the gas within its container. All right, so let's take our syringe example here and take off the cap that was holding in those gas molecules. All right, over on the left is our starting syringe with a given volume of gas or air within it. However, because it doesn't have a cap on it, the gas molecules are free to move in and out of the syringe. So after a certain point, the gas molecules will reach a type of equilibrium. So just as many gas molecules are going in as are going out, and so the internal pressure will have some measure. All right, if we take our syringe and pull back the plunger, we're increasing the overall volume, increasing the volume. And because there's more volume, there's less pressure of the gas molecules within the syringe. And because the pressure is lower inside the syringe, that produces a pressure gradient between the inside and the outside of the syringe, and the higher pressure outside of the syringe helps to basically push more gas molecules into the syringe. So that is similar to basically inhaling. The pressure inside of the lungs is less than the pressure outside, and that helps to draw air in. So the converse situation is if we push the plunger in, that decreases the overall volume. With a decreasing volume, we have a higher pressure inside of the syringe, and that pressure is going to be greater than the outside pressure. And so because gas likes to flow down its pressure gradient, the gas molecules will then flow out of the syringe. So this pressure-volume relationship is what helps to explain movement of gas molecules from the inside of the body to the outside and from the outside in. And that relationship is described as Boyle's law. All right, so let's consider these pressure changes that happen over the course of a respiratory cycle. The heart has a cycle of activity. It contracts and then it relaxes. And we call that a heartbeat or a cardiac cycle. The respiratory system also has a cycle of activity. And we call that the respiratory cycle. So the respiratory cycle consists of one inhalation followed by one exhalation of air. And the number of times that happens per minute is referred to as the respiratory rate. And the respiratory rate can vary depending on if you're old, young, male, female, your state of health. So that varies somewhat. But a resting respiratory rate is somewhere between about 12 to 20 breaths per minute. All right, so let's look at the change in pressures over the course of a respiratory cycle. When we are neither breathing out nor breathing in, the pressure outside of the body is about 760 millimeters of mercury, as is the pressure internally, approximately 760 millimeters of mercury. So there's no net movement of air when the pressures are equivalent between the inside and the outside. When we go to take in a breath or inspire air, the rib cage is drawn up and out. The diaphragm is drawn down. And this causes the volume of the thoracic cavity to go up. So our volume is now increased from where it was. So the inspiratory muscles, namely the external intercostals and the diaphragm muscle, tend to cause an increase in volume of the thoracic cavity and of the lungs. And since that volume is higher, the pressure within has now decreased. And so that pressure difference there helps to promote a movement of air into the lungs. Okay. So at that brief moment between inhaling and exhaling, there's no net movement of air. the outside pressure roughly equals the inside pressure. However, when it's time to exhale, the volume of the thoracic cavity becomes smaller. The rib cage draws in, the diaphragm moves up, and because the volume is lower, that causes an increase in the internal pressure. That sets up a pressure gradient where the inside pressure is greater than the outside pressure, and that promotes exhalation of air to the outside of the body. So the change in volume changes the pressure, and the pressure difference is what helps move air into and out of the lungs. So to wrap up this video, let's consider a couple of questions here. The first question is, air moves out of the lungs when the alveolar pressure inside the lungs is A, greater than the pressure in the atmosphere, B, less than the intrapulmonic pressure, choice C, less than the pressure in the atmosphere, or D, equal to the pressure in the atmosphere. All right. Well, after considering those choices, I hope you chose A, greater than the pressure in the atmosphere. Remember, the pressure inside has to be greater than the pressure outside, and so that